Varicose veins are typically a visible symptom of underlying venous insufficiency. Your veins are the blood vessels in your body that are supposed to take blood from your extremities back to your heart, okay? Which means generally from your legs, they need to flow upwards against gravity. When people are on their legs for long periods of time or straining or just, working, gravity catches up with us at some point, and sometimes those veins can start to pool with blood. That happens because the valves that are supposed to function to stop blood from flowing the wrong direction inside the veins become faulty and no longer work. And when that happens, blood pools inside those veins, causing them to distend and grow larger. And over time, they can be unsightly, painful, and quite frankly, progress into other diseases that may cause ulcerations and infections. And so treating them is a mainstay of helping people feel better. A vein closure procedure is a relatively straightforward procedure. It doesn't typically require any sedation. There's a single puncture of a vein, usually down by the ankle, where we then put a catheter inside the vein and then fill that vein with a glue or use a laser to actually cause it to shut down along its course. It's really just one needle puncture, and we give lidocaine, which is a numbing agent. So generally people feel one poke, and then after that nothing inside is really palpable or you don't feel anything at all. It's a quick procedure, it's a relatively painless procedure, and the improvement in symptoms is near immediate. So if you've been living with chronic symptoms of fullness, heaviness, restless legs, maybe you have numbness, tingling, or pain, especially when you're up and out of the house, it's limiting your ability to do your groceries or play with your grandkids or whatever it may be, you think a 30-minute procedure and a little bit of discomfort could really improve your quality of life going forward. This is a patient who had very severe varicose veins and what we call reflux in the greater saphenous vein. So on the left screen, we have an ultrasound that we perform to assess the veins beforehand. This is the greater saphenous vein. It's dark black because there's blood flowing within it. It's dilated, it's close to the skin, and when we compress it, it disappears completely because it's compressible, meaning it's filled with blood, and we can collapse it out of the way. That tells us that the vein is open. On the right image here, we have the patient after what's called a venocele closure, where we use a medically approved glue to fill the blood vessel and clot it off, such that blood cannot flow the wrong direction through the vein. And when that happens, we see that the vein decreases in size a little bit, but more importantly, when we compress on the vein, it doesn't collapse. It doesn't collapse because it's completely filled. That way, no blood can flow the wrong direction, the reflux stops, the varicose veins improve, and the patient's symptoms improve with it.